Yeah, sorry for interruptions. So, as the pediatric glaucoma is a serious cause of childhood blindness worldwide and is often poses a diagnostic and therapeutic challenge to the ophthalmologist, and PCG is the most common one. So, UBM is a high-resolution ultrasound technique that allows to non-invasive in vivo imaging of structural details of the anterior ocular segment equal to nearly a resolution of light microscopic that you usually see in histopathological examinations. So it's useful for assessing the morphology and understanding the various pathology of the anterior segment in the glaucoma. It helps in examination various, as already told the previous speaker, it helps for examination of the anterior segment in an obscured cornea or any structure behind the iris. It has a role in diagnosis in challenging cases and help in prognosis of the cases also. So normally, normal cornea usually look like this. This multi-layered structure and outer hyperechoic layer that contains epithelium. The stroma is more of minimally echoic than the inner one. The desmet is the hyperechoic. So in anterior segment, the first the Schwalbe's line, that is the junction of translucent cornea and opaque sclera. The second picture I took from this article, She's et al. Published in PLOS 1 2020. They had used it to 80 megahertz probe. So they could identify even Schlemm's canal in a better way, and they could identify the thickness of the trabecular meshwork also. So the next one is the identification of the most prominent landmark, that is the scleral spur. Scleral spur is the junction. It is the anterior limit of the junction of your sclera and the ciliary body. So that is the constant marking. After identifying scleral spur, then you can assess the trabeculo-irido angles. If possible, there is iris thickness, because PCG there is a changes in the iris thickness that I will be coming to later on. And this is the ciliary process. This is the anterior chamber depth, peripheral anterior chamber depth. This is the corneal thickness, the periphery. This is the posterior chamber. So next, the lens is usually a spindle-shaped structure. Here you could see the spindle-shaped lens, though there is a cataract, and this is the zonules. This is the ciliary body, and this is the ciliary sulcus, that is space between the ciliary process and the posterior part of the iris. So what are the changes in PCG and compared to normal? In PCG, from the cornea, there will be loosening of the epithelial layer, that is less echoic, and there is a corneal edema, hence there is a thickening. In the lower part picture, there is the corneal thickness measure is more than 1500, more than 1.7 millimeter. If there is a defect, that is the desmet tear, you can well appreciate it in the UBM. Initially, there is a defect in the desmet layer, and the margins are delineated as excavations. So this will be corresponding to your desmet tear. So what are the changes in primary congenital glaucoma? In the PCG, there is a widening of the trabecular irido angle. There is a thinning of the iris. And there is like this schematic diagram shows that there is shortening of the Schlemm's canal, and there is different type of that is abnormal iris insertion that I will be later on. And they could, Dr. Shi and et al., they could appreciate even the membrane also, that is the membrane that usually demonstrates histopathologically in the primary congenital glaucoma. They used actually 80 megahertz probe. So they graded the angle, depends on the insertion of the iris and ciliary body. The severe dysgenesis means both the iris and ciliary process inserted anterior to the scleral spur. The moderate one is the iris inserted at the level of the scleral spur, and the mild one, that is the posterior to the both iris and ciliary body inserted posterior to the scleral spur. What are the importance of this grading? They found that if there is a severe dysgenesis, one could better for a filtration procedure rather than going like canal-based procedure like microcatheter assisted goniotomy. They found that for the severe dysgenesis patient perform poor after a micro-assisted trabeculotomy. And also if there is a total dysgenesis or severe dysgenesis, there is an absence of CYP1G1 enzymatic activity. In case of milder one, at least there have a 60% preserved CYP1 enzymatic activity also. So just quickly go through some of these structures, like this is the case of Peters anomaly. There is a defect, central defect in the desmet along the defect in the stroma that can be have different grades. That's here is a minimal, here is somewhat moderate. Sometimes the iris and lens can adhere to this structure. This is a case of Peters anomaly. Microspherophakia, this is the normal contour of the lens, should be the normal contour of the lens. Here the lens is more globular. When you track, this is the posterior extent of the posterior capsule. There is a globular spherical lens that's suggestive of microspherophakia. This is here you can see there is adhesion or tending of the peripheral iris along the peripheral cornea, and this is a case of Axon-Rieger field anomaly. Congenital rubella, ma'am did extensive work on this. This is a poor prognosis case. UBM helped to diagnose the congenital cataract, which is also part of congenital rubella syndrome. If we miss the cataract, the patient will visual rehabilitation will be difficult. So you need to diagnose it before your surgery. Even we can diagnose it before even doing the primary procedure. And this in this picture you could see there is hypoechoic area that is suggestive of fluid between the anterior and posterior stroma. This is a picture of a case of acute hydrop. The last one is the congenital aphakia. There is one should not miss this case, but there is a single chamber. There is no structure behind visible. There is more of a single chamber. So pre-operative diagnosis is very important. If you miss pre-operatively and go on for surgery, the eye will be invariably going for a Thi-6. So in conclusion, UBM is a good tool for detection of anterior segment changes in congenital glaucoma. And identifying the scleral spur is the key, which is UBM is helpful especially in cases of opaque cornea or cases with borderline clinical finding, helpful for grading of the PCG and other congenital anomalies, even can prognosticate the disease. I thanks all the teams, and ma'am, I took all the majority of the picture from ma'am's library, and Dr. Ashok, Dr. Sagar and Dr. Gaurav for giving pictures for these presentations.
Thank you, FAISAL.